If you're feeling discomfort in the lower part of your stomach and pelvic area, you're likely to be experiencing pelvic pain. Pain that occurs in these areas and lasts longer than 6 months is called chronic pelvic pain. While this type of pain can occur in all women, chronic pelvic pain is very common in women in the military, both active and retired. And as many as 1 in 3 female veterans experience chronic pelvic pain, compared to 1 in 10 women who have not been in the military. Military women have pelvic pain for a variety of reasons. Those on active duty regularly participate in types of high-intensity exercise that can aggravate their pelvic region and make them more prone to injuries in that area. Stress and incorrect breathing techniques while in the field can cause pelvic muscles to tighten up, which can lead to pain. Military sexual trauma and mental health conditions like anxiety, depression, and post-traumatic stress disorder, PTSD, can also increase one's risk of pelvic pain, as can smoking and substance abuse, which some people turn to as coping mechanisms for dealing with a stressful lifestyle. When it comes to preventing or reducing pelvic pain, being proactive can go a long way. It's important to make sure that you're wearing a properly fitting uniform. Wearing poorly fitting uniforms, like oversized body armor made for men, can put pressure on the pelvic area. Some servicewomen have even experienced pelvic fractures from belts with large metal buckles made for their male counterparts. Just about any exercise, if performed incorrectly, can strain your pelvic region and lead to pain. So, take time to learn the correct way to perform a strength training or cardiovascular exercise, and practice standing with good posture, even when off duty. A pelvic specialist can assess your specific condition and personalize a physical therapy protocol for you. Exercises like Kegels, for instance, are not a one-size-fits-all solution to pelvic pain. For some women, they may help, but for others, the exercises may make the pain worse. And 70 to 80% of women do Kegels incorrectly if they are not taught how to do them correctly by a professional. Stretching can be a great way to reduce tension in your hips. Lying on your back with your arms at your side, palms up, with your legs up against a wall, can help to release some of that tightness. Other positions can also help, like the child's pose, where you kneel on the floor with your toes together and your knees hip-width apart. Lean forward and place your forehead on the floor. Incorrect breathing can lead to tightening of the pelvic muscles. Practicing diaphragmatic breathing can relax those muscles. Breathe in slowly from your nose, letting air deep into your belly, then exhale slowly. Your belly should rise and fall with each breath, and your chest should remain still. This can help to properly engage your core and can also be used whenever you feel stressed. Stress and anxiety can be another cause of pelvic pain because they make your pelvic floor tighten. Finding an outlet for stress, whether that's yoga, tai chi, mindfulness, meditation, can also help prevent pelvic pain. Military sexual trauma, PTSD, and sexual abuse can also lead to pelvic pain. If things get too overwhelming to manage on your own, make an appointment with a mental health professional. Try to find an expert who has experience treating the condition you're experiencing. Stigma in the military often results in women being dismissed for pelvic pain and told that it's all in their head. But this type of discomfort is very real. If you're feeling these symptoms, speak to your primary care manager and ask for a referral to a pelvic specialist. The sooner you ask for help, the sooner you can find relief. For more information, please visit military.healthywomen.org.